On this edition of the Best Docs Network featuring Forest Park Medical Center, Dr. Garner Newton, Dr. Jonathan O, Dr. Thomas Hung, Dr. Jeff Angobaldo. Hi again, everyone. I'm Candace Kruger along with Jim Knox. We're back again with another edition of the Best Docs Network featuring Forest Park Medical Center. Of course, Jim, Forest Park Medical Center is one of the premier medical centers in all of the Dallas-Fort Worth area.
No doubt about it, Candace. Also out of Forest Park Medical Center, some outstanding physicians operate right here, including our first physician, one of the top plastic surgeons in the entire Dallas-Fort Worth area. It's Dr. Richard Haw, who helped one little girl, it's one of my favorite stories, helped one little girl with a bilateral cleft lip and palate.
Babies with cleft lip and palate are born every year. The incidence is about 1 in 700. So while it's not very common, most people probably know somebody who may know somebody who had a cleft.
When we got our referral approved from the Chinese government, it said that we were going to get a child with bilateral cleft lip and palate. We took our referral picture to Dr. Hall and asked him if he could fix her. And he said, I'd be happy to. And I was thrilled. It was a huge sign of relief that he was going to be there for us.
Andrea is a delightful child. She came to me after being adopted from China. She had a bilateral cleft lip and palate, so that was a little bit more severe deformity than you might find with a one-sided lip or just an isolated cleft palate. But she had some work done in an initial repair in China. Clearly, a very rudimentary repair had been done, and she didn't have the full treatment plan completed.
I've heard that the average cleft child has 8 surgeries, and she will be average. She's had 7 so far.
The treatment plan for these patients starts at very early age. A lot of specialists are required to help take care of these babies in the proper way. It's not just the plastic surgeon who's going to be doing the repair, but you need speech pathologists, orthodontists, dentists, as well as ENT surgeons. And together, you come up with a comprehensive approach and a treatment plan. So I performed a lip and nasal revision, as well as fixed the remaining hole in her palate, as well as did a procedure for her to improve her speech.
Her next procedure will be when she's around 16, where they'll move the upper jaw forward and do maybe a rhinoplasty as well.
She had initially had some language transitional issues, but quickly learned English, and she is very well integrated and just a happy child at school.
She looks fabulous, and she's a resilient child. She's always happy, and she loves the way she looks. And Dr. Hall has really changed her life.
I love Dr. Hall.
One of the things that is important in nursing or any type of career is making sure that everyone is well educated on what the expectation is of the facility. When I became the CNO here at Forest Park, I wanted to be able to focus on clinical education to make sure that we were always providing safe care to our patients and that all of our clinical staff were able to be educated on doing the same thing every single time to make sure that there was no room for any type of errors to occur. With that thought, we developed an educational program and hired a clinical educator that is master's degree prepared to be able to provide that type of education to our staff.
My role as clinical educator here at Forest Park is just to make sure all clinical staff are up to date on all evidence-based practices and current literature, and making sure that we provide our patients with top-notch care that is contingent on what research is backing these days. I teach anything from American Heart Association classes to ventilator classes to classes on hemodynamics to classes on basic needle sticks, blood draws, anything in the healthcare arena.
Clinical education is very important to both of my areas because as everybody knows, healthcare is always changing. We are updating our processes, we are finding new and better ways to take care of patients, and I want to ensure that my staff is doing everything they can to provide the best care they can to our patients. And so here at Forest Park, we have our clinical educator, Dan Cloud, who is very active with the staff, finding out what areas they feel like they need education on and finding out what is the newest research and articles that are out so that we can make sure that we're staying abreast of all of the newest research and practices.
Just seeing some of the nursing staff or clinical staff when you're teaching them something, when it finally clicks or they can take it back to the bedside with them in their interaction.
Pain at night that tends to wake them up and or they can't sleep on that side. The first thing you do is get a good physical exam. It's very important to get a good physical exam and history to see how they may have injured it, because you want to pick out if they injured it in a specific trauma or a lifting type episode, because it matters a lot on what you decide to do as an orthopedic surgeon.
Dr. Newton suggested that surgery was in fact the solution, that it would not heal itself and the pain would not subside, the discomfort would not subside. It was a very easy election.
The rotator cuff surgery is something that can be done either arthroscopically or through a mini open type procedure. The way I decide to do it has a lot to do with the type of tear, how big the tear is, and the patient. If we decide to do it through the scope, the incisions are obviously much smaller, but that would require, in my opinion, a smaller type tear that wouldn't require multiple anchors, multiple sutures like in a large to massive tear.
Dr. Newton made it very clear that with each patient and each surgery it could be slightly different. He was very optimistic that it was a routine procedure and that I would be pleased with the outcome, which I was. It's been 8 months. I feel fairly unlimited at this moment in time. I feel that I'm on my way to being 100%.
Did you know that in 2011, Forest Park Medical Center was voted as one of the top 20 most beautiful hospitals in the United States? Also, Forest Park Medical Centers were the only hospital in Texas to make this prestigious list.
For more information on Forest Park Medical Center or any of the fine doctors that operate right here, just visit our website, bestdocsnetwork.com, and click on the Forest Park Medical Center tab. Next up, let's check in with Dr. Jonathan O.
Here are stages of cancer. Basically, stage is just a way of classifying how far the cancer is spread. And every disease type has their own way of staging things. So the staging for breast cancer is not going to be the same as staging for ovarian cancer, obviously, because it's completely different diseases. But that's generally what we're trying to do, is trying to get an idea of how advanced the cancer is. And once we know how advanced the cancer is, we can generally give people an idea of what the prognosis is. That's ultimately what's important. You're not so much worried about stage, you're more worried about, are you going to be able to cure this? So, and stage kind of gives us an idea of what the cure rate would be. For gynecologic cancer, after surgery and what we call adjuvant therapy, and adjuvant therapy will just be either chemotherapy or radiation after surgery, patients undergo what we call surveillance. Surveillance is just a fancy term for keeping a close eye on things. Typically, we have the patients come back in to the office anywhere from every 3 to every 6 months for an exam and blood work. We want to keep an eye on things to make sure that the disease doesn't come back. Chemotherapy is just a fancy term for medical therapy. Traditional chemotherapy is an IV infusion. So just like if you were to go to a hospital, you get an IV placed, and these are medications designed to help kill cancer cells. And for the most part, the way I describe it is it's very expensive, very well thought out poison. And it's poison that's designed to help kill cancer cells before it causes too much damage to normal cells. Length of treatment depends on the type of cancer the person has and the treatment option that they decided for. But usually it's about a 18-week treatment course. There's a number of trials that are ongoing through our research division that's based out of Mary Crowley here in Dallas. We have a number of clinical trials open for not just gynecologic tumors, but also breast cancers and multiple other disease sites. We have targeted therapies. We also have tumor-specific options, such as vaccines. So a lot of these tumor vaccines are created at the time of surgery, where samples of a person's tumor is sent to a lab, and this lab creates a vaccine targeted specifically against that person's tumor. That's something that's under clinical trials here in Dallas that I'm very actively participating in.
Today's Ask the Doctor comes from Mary. Mary has a question for Dr. Lowell Ku. My husband and I are trying to get pregnant. When is it time to seek a fertility specialist?
Many couples may wonder, well, after how long should I be worried that maybe something's wrong, and when should I see a doctor? Well, the true definition of infertility is when a couple has been actively trying for over a year without success, as long as they're under 35 years of age. If they're over 35 years of age and they've been trying for 6 months or greater, then they should seek help, and they would be considered to have infertility. So if you are under 35 and you've been trying for over 1 year, or if you're over 35 and you've been trying for over 6 months, it's time to seek help.
December the 4th, woke up at a girl's Christmas party and couldn't walk. Had to call my husband and say, baby, come and get me. I was in tears. Come and get me. You've got to take me and get a cane. I said, I've got to do something. I've got to do something. Went to the doctor to get some medicine for my knee, and she goes, you're looking at knee replacement. I'm going to have the bariatric surgery first, and if I have to have the knee surgery after that, I will.
Why does a gastric sleeve work? Well, first thing, it is a restrictive operation. You can't eat as much because you're removing 70–80% of the stomach. The good news is that you can eat just about everything, certainly not as large a quantities because you'll feel full.
Yeah, it really happened fast. I attended the seminar, very informative. I came right to the office because I knew I wanted to do it. I came in and talked to the girls and we started getting things set up. My first impression of Dr. Davidson was that he was very easy to talk to, very easy to understand, very competent. I trusted him just almost immediately.
Wanda's been is a typical success story for somebody who has a sleeve gastrectomy. She's lost about 100 pounds. Her BMI is now about 26. She can eat most everything she could before, not in quite as large a quantities. Wanda does not have reflux after a sleeve. Some people get reflux, but she doesn't.
I had my surgery a year ago, and I'm right at 100 pounds down. I feel awesome. It is the most wonderful gift I've ever given to myself.
Wanda's doing great. She's 1 year post-op this month. She's met all her goals. She does not have GERD. Her knees don't hurt as much, and she's taking her vitamins. She keeps doing these things of doing some exercise, taking her vitamins. We'd anticipate she should do just great for many more years.
Dr. Davidson changed my life by offering this surgery to me. He wants you to take care of yourself That's the awesome thing about Dr. Davidson. He wants you to be the best you can be. Dr. Davidson gave me the confidence it took to proceed with vertical sleeve gastrectomy.
You know, Candace, March is National Nutrition Month, and at Forest Park Medical Center, nutrition as well as healthcare is basically around the clock.
Absolutely. They take fine dining to the next level, and it's just another way that they stand a step above the rest. Let's take a closer look.
I assess patients based on their nutritional needs, if they are at nutritional risk, if I need to do any kind of intervention as far as medical nutrition therapy, which is prescribing certain diets. For example, if a patient has diabetes, then we would order a diabetic, heart-healthy diet so that it would fit into their meal pattern to help control their blood sugars while they're here at the hospital.
Having a culinary team in place definitely gives us an avenue to provide great meals. We feature anything from gourmet pizzas to ready-made salads to order. Everything's prepared fresh right in front of your eyes, and we try to do that in a timely manner.
Forest Park Frisco Cafe Services incorporate patient and family members into our dining experience. So if there's something available down in the cafe that is not on our written menus that a patient can select from, it's still an option that a patient can receive those items from the cafe directly onto a tray up to a patient room.
With Krista, we follow a pretty strict menu that we put out of the back, but then there's also special people with allergies or people that can only have certain things. We're a small enough hospital that they really get a personal care. She touches the patient every day. She brings down the information to us, and we take care of whatever culinary needs they have.
We have people from Frisco City Hall that come and frequent our dining establishment quite often, and they let us know how well we're doing. And I thought it was pretty unique to have people walk down the street, come into this facility. They're not patients, and they don't have any family members here at the hospital, but they just want to try us out because they've heard from other staff members that work with them of how good the food is.
Our menu is not typical hospital fare. It has a lot of, I'd say, Texas twist to it. It's anything from fine dining up in the doctor's lounge to some of the caterings that we do for the doctors, and then down here we try to do things a little more regional, use some of the local produce, try to make it more of a resort-like setting.
Food and nutrition is a lot about lifestyle changes and lifestyle behaviors, and those things don't happen overnight. So what little coaching that I do get to give patients here in the hospital is mostly through a paper that they can take home with them and do some extra research on it. We try to give contact information for the dietitians as well, so if they have questions post-op, there's always someone available or some kind of way to get the extra information that they may need.
Did you know that Forest Park Medical Center Dallas has the AccuVein Vein Finder? This allows the phlebotomist to actually see the vein before drawing your blood, eliminating multiple sticks.
Adhesions are the normal healing process of our body. If you get cut anywhere on your body, you develop scar tissue. You develop that same scar tissue on the inside of your abdomen, but what can happen then is that scar tissue then can cause organs to stick to each other. So the ovaries can be stuck to the pelvic sidewall or stuck to the uterus. The bowel can be stuck to the back of the uterus. So with all of this can contribute to some of the pain that women experience, especially with infections or endometriosis. And until you get the endometriosis out, those scar tissue is going to continue to grow. It's going to continue to interfere with their normal functions. 60% of bowel obstruction are from scar tissue and adhesions. So yes, this can be a bad problem. They usually start off slowly growing, and then they get thicker, they get their own blood supply, their own nerve system, and they hurt as time goes on as this disease progresses. So if endometriosis is the culprit that has initiated the growth of these adhesions, we have to go in and cut those adhesions because they cannot go away on their own. The less blood loss that you have, then the less tissue damage, any of that can help prevent adhesion recurrence. But it still can recur in over 80% of patients that have already had adhesions in the past. If left untreated, the pain may continue to get worse. So the key is you cut them out. The problem is you've now cut tissue, you have raw surfaces, more adhesions. So there are things that we do to try and prevent these adhesions from coming back. One is we use barriers. We put tissue down or different types of material to try and keep those raw surfaces apart. And unfortunately, other than maybe trying things like acupuncture or alternative methods, to physical therapy, anything to try and help relieve the symptoms, there's really not many alternatives other than surgery and trying to prevent the regrowth.
Don't forget, for more information on any of the outstanding doctors or technology right here out of Forest Park Medical Center, head to the website bestdocsnetwork.com and click on the Forest Park Medical Center tab. Now it is time to head to our next best doctor who operates right here out of Forest Park Medical Center. It's Dr. Thomas Hung.
Before I had a chance to get with Dr. Hung, I was kind of suffering with allergies pretty severely, whether it be like sneezing or not being able to breathe or not being able to breathe without opening my mouth. And then also every time I would sneeze or have any allergic reaction, anything, it would swell up so severely it just no air could pass through. And so I had gone to multiple allergists my whole life.
Jennifer came to me because she was primarily experiencing nasal obstruction. It had been going on for most of her life. She did not have any clear history of any nasal injury or any accidents in the past, but she found that she was unable to breathe from both sides, but it seemed like her right side was more affected. And after years of medication, she still wasn't getting the relief, and she still felt like she wasn't breathing as well as she should.
We talked about if I wanted to do rhinoplasty as well, which I ended up doing because I did have a hump, and then they straightened it out, but I also wanted to not let it look like I had had my nose fixed, if you will, and so he just took my bump out and then corrected my septum, which kind of straightened everything up.
The surgery entailed straightening out her septum and shrinking down the turbinate to create more room in both the right and left sides of her nostrils. I also used some of that septum to create some grafts to help support the nose, because part of Jennifer's problem was that the framework of the nose was starting to shift and collapse, contributing to her nasal obstruction. And so I used some of her septum to help re-support the nose.
You can make it as big a deal as you want, but for me personally, my recovery time was nothing. There was only upsides for me.
A lot of people just go through most of their lives really not knowing sort of the potential of how well they can breathe through their nose. It's very hard to sort of be able to mimic with medications or anything like that what it's like to sort of optimally breathe.
It was literally one of the best things I've ever done.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
One of the main reasons why I came to see Dr. Angobaldo was because I was not happy with the symmetry of my breast. I do body figure competitions, and when I lean out, you could really see the symmetry of my breast, where my left one was a lot lower than my right one. The implant was very noticeable. And also wearing a bikini two-top, you can see that the left breast was a lot lower than the right one. And so I always either had to pad it or tape it or do something so that it wouldn't be as noticeable. And it was just very bothersome.
So the initial consultation with Claudette, she was unhappy with the asymmetry of her breast. She had previous breast implant surgery by a different surgeon several years ago, and she thought that one implant was lower than the other, which caused less fullness in one breast than the other. She was very self-conscious of that. She competes in fitness competitions, and she wanted also to switch out from a saline to a silicone implant.
As far as the procedure, pre and post, the pre was very comforting. The staff was wonderful. I never felt nervous. Everything from Dr. A to the nurses and anesthesia was great. Post-surgical, probably 2 to 3 days is what I took. And then I was able to get back into my everyday life routine.
Claudette is doing fantastic. She is 5 weeks off from surgery. She's had no complications. She's perfectly symmetrical. She looks fantastic, and she sees, I'm gonna free her up to start competing again and working out within the next week or so.
Now that I've had the surgery and I'm symmetrical, it's definitely a boost of confidence. I don't feel like, I'm being watched or, I'm lopsided. So I can't wait for my next competition. Dr. Angobaldo's bedside manners, for me and my experience, were wonderful. He was very positive throughout the entire process, starting from the consultation to the pre-surgical and post-surgical.
When we talk about reflux disease, we actually have a list of the typical symptoms and the list of atypical symptoms. And sometimes we even have patients that come in and they didn't realize that they were having reflux disease.
I had no symptoms whatsoever. The only reason they found out that I had it was because I had entered my 50s and it was time to get a colonoscopy. At that time, I decided to have both done, the endoscopy and the colonoscopy. That's how they found it, and I was totally shocked because I had no idea that I even had it.
We have a lot of people that don't realize that they have reflux disease, and it takes a little bit before they come to the realization that, this is the entity that they're dealing with. And that's very important because having the right diagnosis is going to lead to the right treatment.
I had asked Dr. Ihde to explain it to me because I couldn't quite understand, exactly what he was going to be doing. So now, with this surgery, I stand a great chance of living a normal life and eating what I want to eat.
First, we went in with little incisions and we were able to free up the stomach, close the diaphragm down to the right size. And then we used the newer procedure to create the valve to close off the esophagus so that she wouldn't have reflux. And that involves going down through the mouth into the stomach. We attach to the end of the esophagus, and then we fold the top part of the stomach, what we call the fundus, back onto the esophagus. And that creates sort of a flap valve. As the stomach expands, push the front wall of the esophagus against the back wall, closing it off so that the content in the stomach doesn't get into the esophagus, which is what reflux is. 2 weeks after surgery, her symptoms have been resolved. She's off of her medications and is working towards getting back to a normal diet. So she's very happy with the procedure, and I think it's a testament to the way the procedure works.
Just to know that he took care of that problem for me, and my stomach will open and close, when I eat, my chances of living a longer life are so much greater.
That'll do it, everyone. That'll wrap up another edition of the Best Docs Network featuring Forest Park Medical Centers. Of course, Forest Park Medical Center is one of the premier medical centers in all of Dallas-Fort Worth.
And for more information about Forest Park Medical Center, all the outstanding doctors that operate right here out of Forest Park Medical Center, the great technology, head to the website, bestdocsnetwork.com, and click on the Forest Park Medical Center tab.
Thanks for tuning in. We'll see you next week.